one. Good dog, Dr. Thomas Albrechtsen.
Hello, how are you?
I'm doing great, thank you. It is my honor and privilege to have you on my channel. Thank you very much for sparing your time. Tack så mycket. Did I pronounce that right?
You did it very well. It sounded like Gamsa Habnida.
Right.
Good.
Before we begin, I would like to start off with some icebreakers, if that's okay with you.
Whatever.
It's called Would You Rather? All right, so I will be asking you seven questions in total, 5 of Would You Rather, and at the end I will ask you 2 questions of your favorites. So let's begin. Number 1, would you rather drink coffee or tea?
Both. I have to choose one, have I?
Well, you could say both, but maybe 1 more %.
Yeah, that's difficult, but let's select tea then if you like. I don't mind. I don't really mind. Doesn't matter. Please continue.
All right, okay. Number 2, would you rather eat Janssen's Temptation or Rockmut with lingoberries?
I would prefer the Temptation. Yes, indeed.
All right, okay. Number 3, would you rather walk 2 stops or take the bus when it's raining?
I would much rather walk 2 stops, even if it rains. Oh, yes.
All right, okay. Would you rather stay in or go outside on the weekends?
Well, that depends on the weather, but I would rather go out if it's possible, yes.
All right, you would go
I would
out.
rather go out on the weekend.
All right, great. Would you rather do something academic or do outside activities with your spouse, who is Dr. Ann Wennerberg?
I always like to be with my wife. So I would go out with my wife as much as I can when I have time for the academic activities.
All right, thank you. Number 6.
The problem is choosing between these alternatives is a bit difficult, but please continue.
Okay, so we're done with the alternatives. I just had 5, so we will go with 2 of your favorites. Now 6, among the thousands of lectures and papers you've published, in which country did you have the most memorable lecture, and which paper still lives in your heart?
The people that stay in my heart are all those who started off with implants a long time ago, when it was still, when oral implantology was still in its infancy. Those I remember by name, every one of them, who came for training in the 70s, early 80s. Those people I remember. That was before the breakthrough. And the other part of the question was whether I...
Which country was your memorable lecture that you had?
Well, let's say then in Canada when we had the Toronto conference.
Wow, okay, the Toronto conference, wow. That must have been memorable, Dr. Albrechtsen. And last but not the least, where is the best place that you went with your family?
The last place where I went with my family was my countryside home on the Baltic.
All right. Was it recent?
Yeah, it was last week.
It was last week. All right. So you had a great time there. Okay. Thank you so much for answering your questions. Dr. Thomas Albrechtsen is a well-known scholar for his academic contribution to dental implants, and he is the father of osseointegration, for he defined it. He has dedicated so much in the implant field. He is the greatest maestro, and expert in dental implants. He is my favorite mentor in terms of research, business, and life. He has encouraged me through hard times, allowing me to have hope, move forward, and stay focused. I would sincerely want to thank you many, many times. Thank you, Dr. Albrechtsen.
Thank you for your kind words.
Dr. Albrechtsen, could you tell the viewers about yourself, where you live, what you do, and anything else that would describe you?
Anything else? What did you say last? Sorry. Anything
that
else?
Would describe you?
Oh, that was a very difficult question. I suppose I would be best described as being still interested in my work, despite that I'm 75 years of age, and that I have a healthy and nice family, which I like very much, and they are all going on very fine with their lives. That's probably the most important thing in life, after all.
Thank you. And where are you living now?
I live in Mölndal, which is a suburb of Gothenburg, quite close to the university hospital. I'm only about 10 minutes away from the university hospital in Gothenburg.
All right. Okay. So it's a suburb of Gothenburg, right?
Yeah, that's right.
All right. Thank you. So Dr. Albrechtsen, could we just a little bit of information for the viewers who are not familiar with the dental implants? How were dental implants found, and what role did you take part in it?
Well, actually, dental implants have existed for a long time, but most of the old types of implants didn't work well and were never actually tested for clinical success. The change came during the 1970s, we may say, when Brennemark, who was my boss at the time, started with osseointegrated implants. And that means that the implants are anchored in bone tissue, in live bone tissue, which the previously used oral implants were not. And if you add to that they now were clinically documented in a meticulous manner, that meant a new treatment regime. Dentists generally were very questioning oral implants. They thought that they didn't work based on the poor experience of those who started in the 50s and 60s. But for the first time, this changed. And even dentists now started believing in osseointegration. And today, I believe that the country that places most implants per capita in the world is South Korea. It used to be Sweden many years ago, but not any longer.
You are definitely right. Yes. I think South Korea is the #1 leading country to install implants, right? Even during the COVID-19.
Yeah. South Korea has the highest number of implants per capita in the world. But there are other countries that place a lot of implants too. It's not only Korea, of course. Everywhere they are used. More than 20 million oral implants are placed annually today.
Wow. All right. So you and Dr. Brennemark did a wonderful job on that. And you have committed your whole life into research for dental implants. What changes do you think are needed in the dental research companies and in the clinics in the future?
What I think one has to realize at present is that the current debate about peri-implantitis is incorrect. Those who launched the theory in question weren't aware of certain facts about oral implants that we are aware about today. And implants are very different from teeth. They have nothing to do with teeth. They don't behave like teeth. They don't show any disease like teeth do. And that is something we have to really spread in the community. To me, the so-called disease peri-implantitis I put in within quotation marks. I think that is a man-made disease. We can lose some bone around the implants, even if they work very well. But generally speaking, that doesn't threaten the implant longevity. We see today a survival of documented oral implant systems in the range of 96 to 100% at 10 years of follow-up. We have very good 20-25-year results, although our modern implants haven't been followed up that long. And the longest followed-up implants I know of, osseointegrated implants, have been in there for more than 50 years. So it has been a new treatment that really has come to stay.
All right. Okay. Very good. Thank you. So you think companies, I read a blog about you recently, and you said companies should do more research. Is that right?
I think that companies that sell things that we place in the human body have a responsibility to document their own implants. We have seen time on and time again that implant systems have been launched and later withdrawn, because they caused unnecessary trauma to patients. When we work clinically, we cannot accept that companies are around that spit out implants without clinical documentation. So I would say that the good results are reported before, 96 to 100% for 10 years. That is with the documented oral implant systems. Lamentably, there are numerous oral implant systems without documentation, and that to use those implant systems, I think, is dangerous and should be avoided. We have to have clinical documentation of everything we use when we place it in human beings.
All right, I totally relate to that. Dr. Albrechtsen, what is the new name of the implant that was just released in Nobel Biocare? Is it Zeal?
Well, companies release, the documented companies, one of them is, as you said, Nobel Biocare. And they have recently launched new implants that have a golden hue color, which is for aesthetic reasons. If a millimeter or two of bone is lost, it won't be, from an aesthetic point of view, that problematic. It's not that uncommon that we lose a millimeter or two of bone. Then there are other documented companies that also now and then produce novelties, and I think we should take them all we should have them all in high respect, the companies that bother with clinical documentation. And there are quite a number of them. So that is something we should think highly of. And Nobel Biocare is certainly one of those.
Okay, so then are all these implants out now in United States and in Asia as well?
Well, with the implants, are you meaning about Nobel Biocare's new implants?
Yes.
I think they are out in Europe and the United States, and I heard recently that they're just about to be launched in Japan. I don't know about Korea, I must admit. Due to the corona situation, I haven't traveled as I usually do, and therefore I only heard recently that these new implants are going to be launched in Japan just about now.
All right. Okay. So probably we'll be seeing them in Korea soon.
Probably in Korea too, rather soon, if not already in Korea.
All right. I'm very much interested with those implants. Okay. And you are the most successful person in the dental field, and at the same time, humble and always trying to help and give. What message would you give to the world or to the young researchers on how to be successful like you?
I think that to reach some success, you have to think about one thing that is more important than anything else. Try your best to be honest. In a world where companies are around, we write scientific papers, and we have to really be trusting what we do. Sometimes we make errors anyhow, and that we have to suffer gladly. Lamentably, we don't know everything when we start. I give you one example of our own errors. When we started, we thought that titanium was an bioinert material, which is absolutely incorrect, we know today, where we can see that they elicit an immune response. But it wasn't that we lied, but we suggested in the discussion of our papers that the reason why they worked well was that they were bioinert, but we were wrong. We couldn't measure immune reactions to implants at that time. We had no techniques, so we will develop things like that all the time. Science will continue. We will have new methods, new approaches, and my advice to the young person is get on working. And then I have another advice. Get on working with your theoretical studies, that's fine. But I have this from Professor Brennemark, my old mentor, see at least one patient a day. I still try to do that. I see at least one patient a day, but I must admit this coming weekend, I will have no patients, at least on the Saturday, but probably on the Sunday. I'm the doctor of a local football club. That is Swedish elite club. So I have always things to do. See at least a patient a day. That's what Brennemark, my mentor, said to me. And I say it to the young people who are now out there. Don't only work with theoretically, work practically too.
All right, that's a great message. So don't work theoretically, but also clinically with practice. All right.
That I think is important, yes.
What patients are you seeing? Are they orthopedic patients?
Mainly today. I used to work with oral implants and with extra oral implants in the past, but nowadays I mainly see orthopedic patients who have problems with after playing football. That's my main stock of patients today at my high age, but previously I've worked with other patients too.
All right, okay, thank you. And for the young researchers, please try to be honest, right? So that's a great message.
Try to be honest, work with your research, but try to also at the same time see patients so you understand the importance of things.
All right, wonderful. Thank you so much. And Dr. Albrechtsen, unfortunately, we are going through the unprecedented times. Could you share with us about the different measures that was taken in your country of COVID-19, and what is your personal view on this?
Oh, dear me. We had a major problem in Sweden since we very rapidly, within a few weeks, reached the peak. We hope it will be the peak. It's very much now the peak. Already in April, we had a high peak of disease. You see, nearly 15% of all Swedes travel abroad, particularly that time of the year. And those who had the greatest problem were those living in Stockholm, our capital, because they traveled during week 9. And that's when we thought there was only some corona at that time in China and maybe some in Italy. That's what we knew about. We didn't know that it was all around in the United States. I don't think even the Americans knew at the time, or in England where people travel, or the ski slopes in the Alps. So they brought home a lot of disease, you know. And we had a high peak, which came already in April. Since then, we have fewer and fewer cases. And the death toll has gone down all the time. Today, we have a very stable situation, it seems like. But one has to worry, of course, all the time that this may come back. You never know. So it's been a dreadful pandemic. I can understand our authorities who had no chance to react to the enormously rapid increase of problems. There were no time for testing. All the resources were given to people in intensive care units. And even one or two of my friends ended up in intensive care units, particularly living in Stockholm. So this has been a tough time indeed. You're quite right. The strategy taken by my own country was not to close down the entire society. We have to wait, of course, to evaluate every strategy until the disease has left us completely, which isn't the case yet anywhere in the world. But we see a very calm situation in Sweden today. And I think that strategy was an interesting one and could have been a good one. That we don't know until all is over. Then we can evaluate different strategies. But nobody could have believed the enormously high rise we had of problems. We had our very first case late in March, and 1 month later we had the peak in disease. It was very rapid. And we put up big tents outside university hospitals that never were used, but just in case. We didn't know how many cases there would be. So if Sweden had done anything different from other countries, I think in the strategy, I think that could have been a good strategy, but it has to prove itself in the long run. So let's wait and see what it will be, what we will say afterwards.
All right, so it would be sort of like a research, right? To see which one is better. Yeah, or maybe it would be a cautionary tale that nobody should follow in the pandemic, you know, because of a very unorthodox open air environment. And I really wanted to know, because right now in Korea, we are toughening the measures and kids have not been going to school since last December.
I see.
And, yes, and we are trying to drop till 0 almost.
Right. Now, Korea has been a very fortunate and good country. You were alert already because you're close to where the disease started, of course, and you were very alert immediately. So Korea has been a country with very few problems, as far as I've understood. Lamentably, in Sweden, we had infections of the elderly people's homes. 75% of those who died in Sweden, they are those either living at elderly people's home or being taken care of by society at their own homes. They fell victims to this disease, unfortunately, in great numbers. That's 75% of all who died in Sweden. And they died mainly last spring. Today we have, as I said, a very stable situation. More problem today, if you forget what we had before, it's more problems around us in the world. United States has more cases per capita than we have, for instance, and they are still having a big disease. Like it seems like we don't have it. At present, we don't have it. We hope that we won't get it back. That we don't know yet.
All right. Wow. So you didn't have masks on, right?
Masks, as you know, for surgeons, are of a limited value, of course, in the sense that you have to change them every half an hour if they're going to be of use, and people don't do that. So therefore, the dominance in our country has been to say people should be 2 meters apart. And that has functioned better. Swedish people we are very obedient. We have always obeyed so if it isn't forbidden or only recommended, people still follow the recommendations. That's well known here. So they haven't said that you can't use masks. For instance, if you travel in buses to your work, it has even been recommended to use masks in bus travel, but otherwise keep a distance of 2 meters. That is a main message. And I think that is a good message. I have masks, of course, since I work at a hospital, but when I see my patients, I usually have put on a mask too. So it's not that it isn't used, but it's more recommended to be apart than to have a mask. And I think that's a good piece of recommendation, as far as I see it. But if you are in crowded environments, like in buses, use face masks, of course. And people are recommended to use face masks then, if you have to be in a crowded environment to go to work.
That's right. Okay. So you had a totally different experience than what we went through in Korea. That's what I think.
Yes,
we shall just wait and see, because in Korea, when we heard the news about what Sweden Sweden was doing in regards to COVID-19, we wanted to see the results, because we are toughening measures. We have to wear masks. We're not allowed to go to coffee shops like Starbucks, for instance, and we're not allowed to go to school. So it's quite like a lot of people are having depression and also cabin fever and claustrophobia.
We still have restrictions, you know, although we have a very good situation presently, we still have restrictions. You can't, you can't go into elderly people's home and say hello to them. That's not allowed. We can't, at present, I think they're discussing of increasing. We have been allowed to gather 50 people. And they are discussing to allow up to 500 if they are not too close to one another at football matches, etc. So there are a number of restrictions still, you know, that we aren't totally without restrictions.
All right.
The report then is given daily, and it seems to be a very good and stable situation, but it surely was not so if you look back in April and May, but all the time since late April, the problem has been going down, very steadily so, all the time and through the summer months and still today. So we have hardly any who die anymore in the disease, but we are anxious that it shall not come back, of course. That is a great danger, you never know.
All right, okay, so let's just wait and see how this will work. Did COVID-19 change your life, if it did in any way?
Well, I mean, I think it changed everybody's life. So that I've been working more from home, writing my papers at home than at the lab, for instance. I haven't been to the lab between March and until 1st of September. Now I've started to go back to the lab. So I've been doing nearly all work at home. I was external examiner on a Norwegian oral surgeon who defended her thesis, Dr. Gjerdet, about a week ago, and that was done via Zoom, the system we are using now when we talk to one another.
How long did that take, the Norwegian thesis?
Oh, it started with that the candidate gave a lecture, so we were from 9 to 3 p.m. We had a short break in the middle. And then we asked the candidate questions, etc. It takes a long time. And then we got 2 external examiners, me and another fellow. So that's Scandinavian style of thesis defense, is that I've been commonly external examiner overseas, Australia, New Zealand, North America. And that's another system, of course. You only ask a question or two, but in Sweden we continue, and in Norway and in Scandinavia we continue for a couple of hours with questions to the thesis, and then another hour questions to the lecture and viewpoints. So it's a tough thing to go through.
It sounds like it is really tough because it's quite different from Korea, yes. Do they do it all on one day?
Yeah, legally, it doesn't end until the last question is asked. It could continue theoretically for weeks, but in practice, it usually takes, if there's no lecture to evaluate, it takes only half a day. If there's a lecture to evaluate, like we had in Norway, then it was longer. But legally, as long as somebody has a question, it has to be asked. Then you have to take a break and continue. I can't remember ever having seen my own thesis started at 9 and ended at 2 p.m. That was the longest I've ever visited, my own one. So that took a long time. But usually they end for lunch, you know, and then we don't continue. We start in the morning and end for lunch, and that's it. We'll start at 1 p.m. and then we are finished by 5, if there's no lecture involved. So
you took 6 hours. It took you 6 hours, right?
Yeah, in my own case, it was quite a few hours, yes, without a break, you're right.
And your PI, your professor was Dr. Brennemark?
Indeed, he was my tutor, my professor, that's correct. This was quite some time ago, in 1979, in my case.
That year I was born.
Yeah, nice.
So in 1979, which month was it? Do you remember?
It was actually in September. It was 21st of September in 1979.
Wow, and you went in at 8 a.m. and it ended at 2 p.m.
Yeah, it took quite a while in my case. I must have been regarded to be either an interesting or a poor case. I don't know which.
I am probably sure it was the former, the interesting part, because nobody would be sitting there for 6 hours.
Let's hope so. Let's
All
hope
right.
so.
Dr. Albrechtsen, what did Professor Brennemark ask you? Do you remember some questions? Were you stuck on them, or were you very confident?
Yes. I got some questions. My external examiner was from outside Sweden. And I remember one particular question was about, it was actually a British external examiner. So he asked me about, can I inform about connective tissue? And I thought that was soft tissue. And of course, I knew from histology that connective tissues actually are cartilage, fat tissue, bone tissue, and soft tissues. And fibroblasts, osteoblasts, adipocytes, and chondrocytes, they are all belonging to the connective tissues. And connective tissue proper is what we call soft tissue. But I misunderstood that question. I remember particularly well that I thought he meant connective tissue proper. I never forgot that. That I learned that very day, that you should say proper afterwards. Connective tissue proper, that is soft tissues.
Oh, but I think everybody would have misunderstood that. Connective tissue proper.
Yeah, that's soft tissue, that's fibroblasts, etc., right? And connective tissues are much more. They include the cells I just mentioned. And that I knew it actually because we had studied it in histology, but I've forgotten that. And usually we talk about connective tissue and mean soft tissue, but actually we should say connective tissue proper. So or soft tissues. If we say soft tissues, nobody would misunderstand it.
Right. Okay. All right, 6 hours. And I mean, it was worth it because now you are a maestro, a master, and an expert. It didn't go anywhere that 6 hours. Wow. Were you standing?
No, I was allowed to sit down.
Okay. All right.
I went to the blackboard to show something, I was standing, but otherwise I was sitting. And so was the external examiner. And then, there is an auditorium too, not only with the faculty members, but also with your relatives. So you have to be very careful not saying too stupid things because you will hear it in the family afterwards if you do.
Oh, so your family
and parents and I didn't have any children. My son is born in 1980, so they were all around, wives, I mean, so they can sit too on the benches, and even they are allowed to ask questions, but they very seldom do, of course. But theoretically, anyone can ask a question.
In Scandinavian countries, is it common to have families sitting in the defense?
Yes, we have big auditoriums, and they sit. The front benches are taken by the faculty members and the external examiner, the certificate committee, as we call it. But then further up, in the auditorium, further back, further up, depending on which auditorium you have, of the family members or friends, a lot of them. I have more than 100 listening to my dissertation, I remember. So altogether.
This is so interesting because it is so different from what I went through. Wow. Wow. Thank you for sharing this. Wow, we could go on and on, but anyway, yes. All right. And Dr.
What university were you at then when you defended your thesis? Were you at Seoul National or?
I was at Yonsei University, Yonsei Dental.
Oh, you were at Yonsei. Oh, yeah. Yonsei, I've been to Yonsei several times. I still have the little memory from Yonsei University on my wall in my department. Oh yes, and that is a very high-ranked university too. So Yonsei was a good place to be at, I'm sure. Very good.
Yes, it sure was.
Well known, not only in Korea, but also abroad, Yonsei University.
Wow, thank you. Yes, because we have some tough criteria to be a PhD at Yonsei College of Dentistry. And also, Dr. Albrechtsen, since you told me that you were working at home for almost 6 months, right?
Yes. You're talking, we are back to the COVID situation now, is that right?
Yes.
Yes, I've been working at home mainly. Well, I had holidays for a month, one must admit that too, but otherwise I've been working mainly from home. And if I have had lectures, I broadcast them and then I send them out I did that the other day to Japan, and having to send one to Turkey later on. I'm going to broadcast another lecture now to that is going to be in the United States, that we send and they show it on the net instead. That's how it is today.
So you're doing online lectures, right?
Yeah, yes, that happens too. That's right.
Can I join, or is it just for certain people who are
Well,
invited?
that depends on the conference. Now it's in the International Congress of Oral Implantology arranged a conference in Japan. I don't know how what limitations they have. They have to decide that. Otherwise, for me, you can join, but whether they have restrictions, I don't know. You have to ask them.
All right, I will. And Dr. Albrechtsen, because I'm asking you this because like following your thesis defense and your PhD thesis, you know, now in Korea, like there was lockdown and we had difficulties going outside. So research, for instance, animal research was quite a problem. Yes. And
of course.
Sorry?
Of course, I understand. Yes, I see.
Yes, and so wet lab and dry lab. So I envied the people who were working in the dry lab, where we're doing bioinformatics or working with computers, because they didn't need to go out their homes, right? So for me, I am probably a wet lab person, and I have to go into animal centers, which were restricted. So my research were quite behind, and even still now, I cannot move forward as much. So I sort of changed, I shifted to the dry lab, working with micro CTs and algorithms.
No, it's been a problem all over, I think. I mean, ordinary research has been difficult, so you're quite right.
Yeah, so how do you work from home according regards to research? And if we ever encounter these kinds of unprecedented times again, what should we do, or what should we prepare?
Well, I mean, the problem we have had here in my own research group, where my wife actually is the head nowadays, I'm only her obedient servant. But in that research group, we were fortunate in timing, because we had already sacrificed a lot of animals and were waiting for the results that would come in. So we have been working on the results, and so we haven't sort of lost that much. I hope that if the situation continues as good as it is now, I think we can start with animal research again easily soon. But at the present, we don't do it. You're right.
Wow. For an expert, the COVID-19 situation just fits into, you know, lots of results after sacrifice. You're very lucky, Dr. Albrechtsen.
Yeah, we were lucky in that situation. That's right.
Yes, very lucky. Yes. All right. So before we leave, thank you so much for your time. But before we leave, one last question. What would be the most cherishable memory in your life?
Oh, my goodness. My goodness, it was a difficult one, actually.
Oh, sorry.
No, I mean, you have to, such, I guess the most memorable situations, actually, must have been with the children, when the children came. I mean, that was the most fantastic. I would say, if I have to single out one time, I single out when my children were born. I have a son and a daughter. And my son, my goodness, in next month he will turn 40 years of age. Oh my goodness, time flies, right? But that, if I have to single out the most important situation of my life, that was the most important situation. Okay.
All right. Okay. Thank you so much. Thank you once again for your kindness and taking time to be part of this. Hope you had fun.
Thank you very much, Jay. We continue being in contact with one another. Thank you.
I really appreciate it, and hope to see you again. Hatte bra vises.
Gamsahamnida. Thank you. Okay.